Hello, and welcome to One World, One Health, where we chat with people working to solve some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that we're all connected: animals, plants and people, and the climate and environment. One good example of a One Health problem is when an infection jumps from animals to people. This has happened with a virus called Mpox. It infects rodents native to Africa and occasionally infects people. It's a distant relative of smallpox, but luckily not nearly as deadly. It is contagious, however, and two different types of Mpox called clades have been spreading across Africa and around the world. And that's another example of a One Health issue. An infection anywhere can very quickly become an infection everywhere. The World Health Organization has declared a public health emergency of international concern. In the Democratic Republic of the Congo alone, more than 30,000 cases are reported, with close to 1,000 deaths. In this episode of One World, One Health, we're chatting with Nodar Kipshidze, Senior Research Analyst at the One Health Trust. Nodar, thank you for joining us.
Yeah, thank you for having me.
Nodar, this is a really confusing situation. There are two different outbreaks going on. Can we try to explain that?
Yeah, that's a great question and a great starting point. The Mpox situation right now is definitely confusing, right? We did have this 2022 Mpox outbreak that was at a global scale and really shifted from our understanding of Mpox epidemiology, right? Because predominantly before that, it mostly kind of circulated in these endemic regions in Western and Central Africa. And with the 2022 outbreak, we had this global expansion that was also affecting specific key populations, such as men who have sex with men, primarily. And the second kind of ongoing situation now is in the Democratic Republic of Congo. There was this outbreak of a separate clade of Mpox. So clades, you can kind of think of them as cousins. These are viruses that are very much closely related, but they're not exactly the same virus. And so this second outbreak began, I think, spring of 2023 is kind of our best estimates as to when this first happened. And that outbreak is definitely different, right? Because there are also other ongoing kind of political and civil unrest issues in the Democratic Republic of Congo. And you have both clade 1 circulating, right, this newer outbreak, but you also have clade 2 from the 2022 outbreak potentially circulating as well. And it's causing a lot of, not necessarily confusion, but it's just complicating the response in many ways because you have these different modes of transmission. And I guess thirdly to that, also the concern that really drove WHO to declare a second public health emergency of international concern this past August was really around how quickly it started to spread to surrounding countries as well. Countries that had never actually seen Mpox, places like Rwanda, for example, which, by the way, is also now dealing with another urgent health emergency, which is Marburg virus, but not topic of today's episode.
Can we talk about how Mpox might have first gotten loose into the human population? In the U.S., a few years ago, it was linked to pet rodents. Could rodents have been the source?
Yeah, that's a great question as well. So the history of Mpox, it's definitely interesting. If those who are interested, I would definitely encourage those to look up the history. But, you know, the very first cases of Mpox were actually in animals. This was back in like 1958. At the State Serum Institute in Denmark. So there was this lab that predominantly was producing and researching polio vaccines, and they had this outbreak of essentially Mpox. At the time, they didn't know it was Mpox or monkeypox virus, and basically that caused a lot of concern because up until then we had smallpox, but smallpox was predominantly thought to circulate among humans and not non-human primates, and so this caused quite the commotion at the time to understand like what's going on here. You know, is there the potential for smallpox to spread across other, animal populations? This is also at the same time when WHO is starting to kind of build up this global plan to eradicate smallpox from the world. And so it's not until like the 1970s we get the first human case of Mpox in the Democratic Republic of Congo I think it was an infant at the time. And then kind of from there, obviously, we have these kind of historical outbreaks that occur. And so as I said before, we have these outbreaks to predominantly circulate in endemic areas, but we also do have cases of, kind of travel acquired Mpox or importation of Mpox into other places. So a great example is back in 2003 in the US, where there was this outbreak of Mpox that affected probably, I think, about 50 people. And that was actually related to the trade of exotic animals as pets. And so this is a great conversation around One Health, right? And how animals can be carriers for disease and how we decide to treat animals and what we decide to do with them, right? This is kind of the consequences of that. So it was actually, CDC did this amazing case investigation into really understanding where Mpox had come from back in 2003, specific to that outbreak. And so they traced it back to this basically like pet trading show where they had these exotic animals that were imported from the African continent. This 2022 outbreak had originated from, and moreover, from the current outbreak. Again, we don't entirely know. Yes, there are typically these animal to human spillover events, but the ongoing outbreak in the DRC, at least from the latest technical reports from World Health Organization, most of these cases now are just human to human transmission. That's not to say there might have been an initial animal to human transmission, but as we've seen, the epidemiology for this can be quite complex, and you have these many different routes and modes of transmission.
And the symptoms kind of can tell you a little bit about the transmission, because this is a disease that it can make you sick systemically, right? It can cause kind of fever and achiness, but it affects the skin. You can get these lesions. And of course, everybody knows what smallpox did. It caused these blisters almost all over. And some of the pictures you see, they're kind of blister-like lesions, but sometimes it's almost more like a rash, and you might not necessarily think it was something serious.
Exactly, yeah. So the case presentation of Mpox varies drastically. So you have more of these mild or moderate cases, I would like to say. These aren't formal classifications I'd like to start off with, but, these are typically people who maybe have just a few lesions or just something that really kind of presents itself as a rash. CDC did a great example, I believe, where they had, kind of infographics of like, is it a pimple or is it potentially a lesion from Mpox? Because that's how easily they could be kind of misclassified, especially if you have no other symptoms. Why would you think that you might potentially have Mpox, right? But then you do have more of these severe cases, right, where you do have a lot of lesions, very painful lesions, other kind of systemic issues like kind of like body-wide inflammation that might require hospitalization. So it's definitely interesting in that aspect where you have this kind of wide-ranging symptomology.
So you can see how it might spread, because somebody they're not walking around with a whole bunch of blisters all over themselves. They might have very mild symptoms and they would very unknowingly spread this.
Exactly, yes. So that's exactly the issue, right? So people might not necessarily know they have Mpox. They might be engaging in certain behaviors that can facilitate transmission. And so this is how we kind of fuel this continuation of the outbreak. With the 2022 outbreak, we continue to have cases globally. It hasn't necessarily died down. It certainly has slowed down. But in places like the US, for example, like nationally, we're still seeing as many as 200 cases per month, which is a lot because Mpox is not really endemic to the United States. So really what we should be seeing ideally is this complete die-off of cases. That's not unique to the US. We are still seeing that globally.
So it sounds to me like there are different vulnerable populations in different countries. In the US and in Europe, it's one population, and that would mostly be men who have sex with men. But in some countries in Africa, it's been little babies and little kids. What's going on here?
Yeah, I think part of this, again, speaks to just the complexities of Mpox transmission, where with the 2022 outbreak, the virus, so to speak, kind of took hold of these sexual networks and found this kind of new route to really efficiently transmit between human to human through really close, intimate contact, whether that's sexual or non-sexual. But that doesn't necessarily preclude that, close contact can be in other settings as well, in like the household, for example, in school settings, as well as just fomite transmission. So this is transmission through kind of inanimate objects. So for example, like things like bedding or clothes that might be shared with somebody who has Mpox and shares with somebody else who doesn't, that can also facilitate another mode of transmission. And so with the outbreak in the DRC, we are seeing a lot of cases among younger children, especially in areas such as like refugee camps or camps for internally displaced people, we are seeing predominant burden or case burden among younger children. And again, that speaks to this kind of the other factors, right, of residing in IDP camps where everyone's very close together. Sanitary conditions may not be high. Resources like for things like bedding probably are pretty limited. And so these are all just kind of factors that can play to persistence of any infectious disease, not just Mpox.
The timing of the appearance of Mpox is a little suspicious. Just as smallpox was being eradicated by vaccination, Mpox was appearing. I personally am old enough to have been vaccinated against smallpox. A lot of people now haven't. Could the two things be related? Could people who were never vaccinated against smallpox have zero immunity against pox viruses and thus be vulnerable to this new virus?
So that is a great question. There was a small study done back in the 1980s by the World Health Organization that showed the potential for potential resurgence or future outbreaks of Mpox based on potential declines in population level immunity against smallpox, right? Because after the eradication of smallpox, there really wasn't this push to continue vaccinating because they didn't necessarily see the need to do that. More recently, there was a study done by the Bonsall Group out of Georgetown that kind of followed or had the same findings, or not necessarily the same findings, but more so showed that like there is this large heterogeneity, so large differences in current population immunity against orthopox viruses in general. And the question is, for those who were vaccinated against smallpox, well, the vaccines we're using today for Mpox were actually originally designed against smallpox, and they're the same exact vaccine. It's just the indication, so the kind of like labels that regulatory agencies put on it has been expanded to include Mpox as well.
Because the good thing about this whole family of viruses is that you can vaccinate against one and protect against all of them.
Yeah, at least that's the current strategy and kind of the evidence we have. Granted, there's very limited evidence on the actual vaccine effectiveness of these vaccines against Mpox, both as a pre-exposure prophylaxis, so before somebody gets infected, as well as post-exposure prophylaxis. So maybe we have somebody who was potentially close contact, we might vaccinate them to see maybe that might offer some protection from developing full Mpox disease. But, in both instances, the data is pretty limited. Granted, now with the 22 outbreak, we had a lot of people vaccinated and a lot more data collected to show we think it's pretty effective. But again, originally when these vaccines were designed, we can't ethically infect individuals against Mpox or smallpox. And so the data that was produced then was kind of what we call correlates of immunity, or not necessarily correlates of immunity, but more so other means of proxies of trying to approximate how effective this vaccine may be.
So how do you think the world's been handling this outbreak, Nodar?
I think for me, at least from somebody who works or does research in public health, the COVID pandemic showed us that how the world and different sectors of industry could come together to really create these life-saving vaccines and therapeutics rather quickly. But then the issue was, how do we distribute those resources, to everybody and not necessarily hoard vaccines? And we did see that with the COVID-19 vaccines, where a lot of low-income countries, unfortunately, did not have access, at least immediately, and had very delayed access to these vaccines. And with Mpox, we have vaccines that have been developed for quite some time, right? We have quite a lot. And unfortunately, again, it's kind of the same story again. We didn't necessarily learn our lesson the last time. And, there is definitely more of an initiative now to get vaccines to places like the Democratic Republic of Congo, where they're dealing with this massive outbreak. But I don't think it's necessarily at the speed that I would like to see it at. I think they just received their first shipment of 100,000 vaccines maybe a week or two ago. But by the estimates from Africa CDC, they need 10 million doses. And currently the initiatives put that kind of delivery of a total of 10 million doses by, spring 2025, which might be a little too late at that point.
Nodar, thank you so much for joining us.
Thank you for having me. It was a pleasure.
Listeners, if you enjoyed this podcast, please share it. You can find links to this and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for listening.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.